Welcome, everyone. Thanks for joining us today. I'm Jonna. I'm going to be the moderator today with Dr. Popowski. I wanted to point out a couple cool features of the GoTo webinar today. There's a questions panel in the panel box. You can go ahead and chat your questions there throughout the webinar. Dr. Popowski will also go through some frequently asked questions at the end as well. So, and we're reserving about 10 minutes at the end to go through your questions. So without further ado, I'd like to introduce Dr. Popowski to talk to us today about dry eye.
Hello, everyone. Thank you so much for joining us. Today, we're going to discuss the definition of dry eye syndrome and some common causes, how we diagnose and treat dry eye, and we'll go over, as Jonna mentioned, frequently asked questions and my answers that I give to patients on those. And we'll have some time at the end, as she mentioned, to answer your questions if we don't get to those. So let's start with the first slide. What is dry eye? Dry eye is a condition that occurs when either your eyes do not produce enough tears or make the right type of tears. And some patients have a combination of both of these problems underlying their dry eye. Next slide. So why is our tear film important? Well, the tears keep the surface of your eyes smooth, hydrated, and protected. And there are 3 layers to our tear film. There's a lipid layer, a watery layer called aqueous, and also a mucus layer. It's important to have all 3 of these components to have a wonderful tear film, as it affects the vision if any of these ratios are off or any of the components are missing. We'll talk about that a little bit more in the next couple slides as well. So what are the most common symptoms of dry eye? Frequently, patients complain about watering eyes. This sounds a little counterintuitive, but it's actually true. If your eyes are watering a lot, it's because they're very dehydrated, and your lacrimal gland that sits up under this orbital bone turns on the spigot and floods the eye with tears. Unfortunately, those tend to just roll down the face and you're wiping them away all the time. Other symptoms include itching, stinging, burning, redness, because when the eyes become very dehydrated, the response is for the white part of the eye, the conjunctiva, to get inflamed and red. I tell patients it's kind of like you have angry eyes because they're so dehydrated. Other symptoms include light sensitivity, eye strain or fatigue, of course, blurry vision, and a gritty or sandy feeling. There are 2 main categories of dry eye. One is the evaporative dry eye or meibomian gland dysfunction. And this is caused when there's a blockage in the oil glands and they're not secreting that lipid, oily tear film layer that's very important. The other type of dry eye is aqueous or aqueous deficiency dry eye. And that's when the lacrimal glands don't produce enough of your tears. Patients can have a combination of these 2 types of dry eye, but typically they lean towards one or the other, and there are very specific treatment options that we use for those. Next slide. In order to have a proper diagnosis, you need to have an eye evaluation. And the way to get the best treatment is to have, of course, the right diagnosis to begin with. A lot of us play scientist and we kind of trial and error different things over the counter to see if they will work. But often patients, when they're sitting in my chair, have tried everything or tried at least a few things that have not worked. And you need to have an eye care professional look at the tear film quality and quantity and figure out what type of dry eye you have in order to find the right treatment. You're going to waste a lot of time and money if you're just trying to play scientist on your own, experimenting with different things over the counter. Next slide. At our office, we have a LipiView interferometer. This is a device that assesses the tear film. We also have a meibomian gland evaluator. These are big fancy terms, but basically we are trying to figure out with all the latest technology and the tools we have available, what type of dry eye you have and how effectively to treat that. Next slide. The treatment options are several, just depending on which type of dry eye you're diagnosed with. If you have that first type, the evaporative dry eye, meibomian gland dysfunction, typically we treat that with LipiFlow. It's a thermal pulsation system. It's an actual treatment we do in the office on your eyes for the oil glands specifically. or we do punctal plugs, and sometimes we need to do both. The second type of dry eye, that aqueous tear film deficiency we talked about, that can be treated usually with prescription eye drops that help your body produce more of your own natural tears. There are three main types of prescription eye drops on the market now that most of us are using and prescribing with great efficiency and effectivity. So LipiFlow, that first treatment option that we mentioned, it's actually a machine that we plug in, and it heats up your oil glands and massages them. That's going to sound a little strange, but it actually feels really good. It's a comfortable procedure, does not hurt. It takes about 12 minutes total, and you're in a nice relaxed chair, and those oil glands are heated up and massaged to allow them to open up and express that lipid layer of the tear film in order to bring back that 3 ratio. Remember, we talked about oily layer, the mucus layer, and the tear film layer, the aqueous layer rather. All of those need to be present in the right ratio in order for your tear film to be correct. So it really helps to stimulate that. So results are not instant gratification. In fact, some people have a little bit more symptoms right after the procedure. However, about 6 to 8 weeks later, you get maximum results, and a lot of the symptoms subside or go away, which is wonderful. Next slide. The other option we recommended for meibomian gland dysfunction or dry eye in general are punctal plugs. This is a device that we put in the lower punctum. There's a little hole towards your nose. If you pull down that lid and look in the mirror, you can see it. And we put one of these little plastic devices, as you'll see on the screen at the bottom there, with a tapered end. And that silicone device, which is a permanent punctal plug, basically plugs up that little hole so that more of your tears will stay on the surface of the eye and keep the eye more moist. Another option, as the slide mentions, is a temporary punctal plug. Those are made of collagen, and they dissolve within about 10 to 14 days. Sometimes we use those for just a post-surgical dry eye or something that's more of a temporary treatment option. And the permanent ones, the silicone ones, as the picture on the slide demonstrates, are more permanent. They don't last forever, but they give you more of a long-lasting effect. And every time you come in, we check to make sure that they're still in the proper position. So how do dry eye drops work? Well, the prescription drops for dry eye, as I mentioned before, help your body produce more of its own natural tears. They also target inflammation, which can be an issue with dry eye as well. So the prescription eye drops on the market, you see Restasis and Xiidra here. There's another one called Cequa. Those help to stimulate that lacrimal gland in order to make your body produce more of your own natural tears. Typically, they're prescribed twice a day and on an ongoing basis. So once you start these, you're usually on them at some dosage for the rest of your life. So let me address some of the most frequently asked questions that patients ask me about dry eye. You may be thinking some of these as you're sitting and watching this presentation. Do treatments for dry eye hurt? Well, no, I would say they do not hurt. LipiFlow, that machine that massages your oil glands, is a very gentle and warm massage. The slide says that patients report some discomfort in the first hour. I haven't had any patients report that to me, and I did LipiFlow myself, and I didn't notice that. But you could have a little discomfort. Eye drops, about 10 to 20% of patients experience burning or stinging with eye drops, especially those that treat dry eye. And the reason is the pH of those drops is different than your natural tear film. And if you don't have much natural tear film, you're going to experience some burning and stinging. So most patients that report burning and stinging, it does tend to go away as their tear film gets healthier and more in balance. Punctal plugs also do not hurt. The procedure itself only takes, about 2 minutes at the most. Your puncta is numbed with some eye drops before we put that little silicone implant in there, and almost every patient says right afterwards that they're surprised it's over and done with. They kind of hyped it up and were worried about that procedure, but they realized it was really no big deal at all. Another question that patients frequently ask is, why is it important to treat dry eye? Well, dry eye can lead to a lot of serious conditions, and when the surface of your eye is at risk or compromised, you're more likely to get eye infections, inflammation, scratches on the surface, or ulcers, and of course, visual disturbance. So why is watering a symptom of dry eye? I said this is kind of a counterintuitive way of thinking, but when there's an imbalance in your tear film, your body's natural response is to keep flooding the eyes with tears. And this leads to just excess tear production and release of those tears from the eye. But as I mentioned, they don't have that good balance of mucus and oil as well. So they tend to just run down the face or spill over, and patients will complain about that a lot. Another question that patients often ask is, why do I have dry eye? Well, the main one here in Colorado is we are not a humid climate. So environment really does affect that tear film. Environment can include being around dusty, smoky environments, if you're a firefighter, for instance, or if you're a smoker, cigarette, tobacco use of any kind. Of course, those fumes can bother your tear film. And if you wear contact lenses, that is a piece of plastic that sits on the surface of your eye. So go figure, it can get dehydrated throughout the day, especially if you're staring at a computer, a Kindle, a laptop, a phone, as most of us are for many hours of the day. Our blink rate tends to go down quite a bit when we're staring at those devices. And so the tear film gets compromised because we're not replenishing it as we blink and moving it back and forth across the surface of the eye. There are also some medical or systemic causes of dry eye. Blepharitis is a condition that can correlate with dry eye, and that is a flaking of the skin around the lid margins, either upper or lower, similar to dandruff that people can experience in their scalp. There are underlying diseases like rheumatoid arthritis, thyroid disease, diabetes, and those can cause issues with dry eye. A lot of medications that you may be taking, you may not realize affect your tear film. For instance, antihistamines for allergies. If you take Claritin or something similar to that, it dries up the mucous membranes in the nose and the throat and also the eyes. So frequently in Colorado especially, we have a lot of allergens that people can be exposed to, and they take antihistamines not realizing that it's drying out their eyes as well. Also, birth control pills, which many women are on, can affect the tear film and cause dry eye symptoms. And then if you've had eye surgeries, especially if you've had surgeries that involve the cornea, which is that outermost layer, the windshield of the eye, that can make you more predisposed to having dry eye issues. Next slide. Jonna, next slide, please. I think we're having an issue with the slide. If you are ready to learn more about dry eyes and specifically whether or not you have it and what type you have, what the best treatment option would be for you, that would just involve calling your eye care provider or calling us here at Skyline Vision for a consultation, and we'd be happy to run you through our battery of tests and use our beautiful LipiView machine and our meibomian gland tester to see what type of dry eye you have and what the best treatment options would be for you. Are there any questions? Jonna, are you there? It seems that we have lost contact with our moderator. So if you have any questions at all, we'd be happy to have someone answer those for you. Skyline Vision Clinic, our phone number is 719-630-3937. Again, that's 719-630-3937. Or you can contact us through our website at skylinevisionclinic.com. www.dryice.com. Thank you so much for attending. I hope you have learned something today. And if you have any questions, please feel free to call us or email us. And we'd be happy to see you for an eye exam and assess your dry eye and what the best treatment would be for you.
Or I see the questions, I can have them all addressed individually. Again, I'm so sorry for the technical difficulties. This has not happened before. I will make sure that we reach out to each of you and handle your questions directly. Thank you so much for attending today, and I will be in touch with all of you.